All right, thanks for coming to Finding the One for Our Son. I'm Matthew Brown, your host here at Madison 365. You can find us on YouTube, Spotify, Apple Podcasts, and Stitcher. All right, folks, hope you're doing all right here. So today I'm going to be talking actually a little bit about our American medical system and the American medical system and racism and all that fun stuff. So recently, and this is really the part of it all. The CDC recently reported that life expectancy in the United States dropped 1 year during the first half of 2020 due to COVID. But it has also reduced life expectancy of Black and Latino Americans by 3 and 2 years, respectively. Now, the U.S. medical system, if you want to call that, is barely a system, and it's just something that's patched together by small healthcare networks and insurance companies, really. It's also a system that has long perpetuated racist harms in Black and brown populations. These harms we label as disparities. It's really just racist harms, but these are multi-layered. Black and brown Americans are more likely to work jobs that don't have healthcare, and also more likely to work in the case particularly of COVID in jobs that are frontline work and service industry work, which is also underpaid. Minimum wage should be higher than should be higher than $20 an hour. But also more likely to live in neighborhoods without access to health clinics either. And racism has impacted Black and brown Americans' position in economic class. Racism in healthcare transcends class. An SSM population health article called Racial Non-Equivalency of Socioeconomic Class and Self-Rated Health Among African Americans and Whites found that racial health inequalities are not fully explained by socioeconomic status, SES, measures like education, income, and wealth. The largest inequities are observed among African American and white college graduates, suggesting that African Americans do not receive the same health benefits of education. African Americans do not receive the same income and wealth returns of college education as their white counterparts, indicating a racial non-equivalence of SES that may affect health inequities. The aim in this study was to determine whether racial non-equivalency of SES mediates race inequalities in self-related health by education and sex. Okay, let's break this down. What this means is that really what we see actually, the more education you have, the more access to resources and the better your healthcare is, which is true among whites. And yes, those that are more well-resourced Black Americans have better health outcomes than poorer Black Americans. The disparity, so the gap between educated Black Americans and educated whites' health outcomes is wider than poor Black and poor whites. What this tells us is that racism within our healthcare system transcends class. Black Americans, regardless of class, are going to be more likely to experience racism within the healthcare system in hospitals from doctors and more. And a great micro example of this is Serena Williams. When she was giving birth, she almost died. And she was trying to tell nurses that something was wrong and they wouldn't listen to her. This is a premier athlete that knows her body in and out. I mean, she won a big one pregnant, right? But they wouldn't even listen to her. And this story is something that we really see across economics, across, like, Black women will tell you over and over that they aren't listened to. And actually, a study has shown racial disparities persist in maternal morbidity, mortality, and infant health. This was released in June 13th, 2020. Gianna conference from the American Diabetes Association, but it showed that American women die in childbirth at a higher rate than any other developed country. Well, non-Hispanic Black women are more than 3 times more likely to have a maternal death than white women in the United States. 3 times. We already don't listen to, but this is part of not listening to Black women, not taking pain seriously, not taking Black women seriously, as well as access. But again, these things go across economics, and multiple studies have shown this. Do rising tides lift all boats? Racial disparities in health across the life course among middle-class African American and whites. This study showed that about that was a previous one that basically the first study I showed really just built upon that. But another study, this is really a really interesting aspect of this. The National Academy of Science found that white medical students, they surveyed 222 white medical students, about half of them, 40%, of first and second year medical students endorsed the belief that Black people's skin is thicker than white people's. 28% surveyed found that students agreed that blacks age slower than whites. The same study showed nearly 60% of white medical students thought their thicker skins. 60%, and then of a different one, of white students. Sorry, that was of the 40% was all of all 60% were of white medical students found this. 12% of white students thought that their Black people's nerve endings, are less sensitive than white peers. And there's this meta-analysis, basically, which took 20 years of studies covering many sources of pain. From this study is called Time to Take Stock, a meta-analysis of systemic review of analogous treatment disparities for pain in the United States, found that Black patients were 22% less likely than white patients to receive any pain medication. This belief that Black people have more pain tolerance is just pervasive within the medical community. And it's real, and just not taking it seriously. My own father was an example of his pain and I think just not being taken seriously. When I was, months old, he was running across a parking lot, stepped into a pothole, and messed up his ankle. The doctor just threw a cast on it and let him go about his day. Apparently, they needed to take a deeper look. He, again, does not taking seriously. He tore up the tendon in his right ankle, and through years, by compensating for the torn tendon in his right ankle, he ended up shredding his left ankle tendon. So when I was around 6th grade or so, he had surgery on his right ankle. This seemed to work. It worked. And then some years go by, and he's getting this swelling and this pain in his left ankle, and he had to have surgery in that ankle. And because of that, he developed blood clots that spread throughout his lungs and literally almost died. I mean, his lungs were filled with blood clots, and if just one broke away and went into his brain, that's an aneurysm. A decision a doctor made when I was months old, 10, 11, 12 years prior to the first surgery on my dad's right ankle, almost cost my dad his life. Now you can chalk that up to a bad doctor, but the thing is, we really don't entirely know. And the chances of that doctor just not taking my dad seriously because he's Black are quite high. Of not wanting to dig deep and just being like, here you go along your way. And you have stories like this all the time in Black and brown Americans. We have the stats, we have the anecdotal evidence, we have the narratives. It's all there. And a lot of this stuff is even compounded on economic and environmental racism. We know that according to a 2015 Stanford Graduate School of Education study, middle-class Black Americans live in pretty much the equivalent of poor white neighborhoods. What this also means, what we also know through environmental racism, is that Black neighborhoods and middle-class Black neighborhoods as well are more likely to live in neighborhoods that have contaminated water, air, and soil. So the very air and water you drink and breathe are poisoning you. That leads to lifelong health disparities with asthma and other health issues such as cancer and things that, you could talk about autoimmune disorders, which I'm in the process of being diagnosed with one. My dad has at least one, and wouldn't be surprising that neighborhoods that he grew up in could have led to some of his own disparate health problems and outcomes as well, lifelong issues that he's faced that have crept up later in life. We know that Black people, Black Americans, more likely to suffer from certain genetic disorders. But when you're talking about things that impact your genetics, such as chemical exposure, this has to be brought into the equation. It's not race per se. It's racism that is causing a lot of these things. Same with diabetes. And we're talking about access to healthy food, access to, in food deserts. And you're talking about, grocery stores, if they are in Black neighborhoods, are less likely to have fresh produce and affordable fresh produce and access to healthy foods. A lot of this stuff is due to access, due to neighborhoods. I mean, there's a Black neighborhood in, I believe it's St. Louis County, that was built on top of nuclear waste holding sites. And we want to talk about racism in health disparities. And this is even a long history of medical abuse on Black and brown Americans by doctors and the government itself. From the 1930s to 1970s, there's forced sterilizations of women in the United States and in its colonies, such as Puerto Rico. Thousands of women in Puerto Rico were forced to be, forced sterilization. More than what we know of, more than 60,000 people in the United States, based on eugenic laws, most Black and brown, during the 1930s and 70s were sterilized. The actual number is probably much higher than that. During that same time span, 5,000 African-American women in North Carolina suffered through forced sterilization. This is beyond, you had the Tuskegee experiment, where our a study on Black men who had syphilis, they said they're being given treatment and till they died of blood sickness. But it was just syphilis. They wanted the study was to see how syphilis progressed. They let these men suffer to study how syphilis progressed as they said they were giving them treatment. Our own military used Black GIs to study radiation during the dawning of the nuclear era. Think about that. They didn't use white folks, they used Black GIs. The entire history of modern medicine, particularly in the United States, and even elsewhere, where these colonial nations used access to colonial subjects, people, humans, to develop modern medicine, doing experiments. Then modern gynecology is built upon experimentation of enslaved Black women with no, pain medication. These very invasive procedures done with no pain medication, nothing, to help them handle suffering at all. We talk about Nazi experiments on Jewish Americans. We don't talk about still a very modern history of our almost entire medical apparatus doing just as horrific experiments on Black Americans. It didn't stop after slavery. It ended either in the United States. These experiments continued through Jim Crow. And you saw the sterilization ended in the 1970s after it was discovered. So it's no wonder that when we talk about the vaccine, there's distrust among Black and brown communities of this vaccine. It is because of a very real, horrific history this country has on conducting medical experiments on Black and brown Americans. So much of our innovations are because of horrors done on Black and brown Americans and many Black and brown women, particularly. This is something that we haven't truly wrestled with, particularly when we talk about, so-called Western civilization and modern medical advances. We don't talk about the cost of those advances. We don't talk about the horrors behind them. And that's what we're seeing now in a lot of ways with COVID, is the lasting impact of healthcare racism, environmental racism, and economic racism. And these things are converging and colliding. These things are only going to continue to be made worse if they're not fully addressed. And we need to really take a top-bottom look at our healthcare system in general. But as climate change progresses, these types of disparities in death and access to needed healthcare and emergency health are only going to become more prevalent as diseases, and they don't have to be viruses, but diseases that climate change helps perpetuate are going to continue to spread as disasters and famine continues to perpetuate. The lasting impact and legacy of colonialism internationally that this country was absolutely a part of are there as well. And even when we talk about vaccine access, we know Black and brown Americans are vastly underrepresented when it comes to getting vaccine access. And internationally, Black and brown nations are being left out when it comes to buying the vaccine. Some of this is due to, a lot of it, racism and capitalism. And that the patents on these vaccines that are publicly funded, by the way, taxpayer funded, are privately held. And they're making profits off of this instead of, these publicly funded research should be available to all. We paid for it. It's not their intellectual property. We paid for this. These are things that we have to wrestle with. These are things that the city needs to continue to wrestle with as it looks to vaccinate this county, this state, and this country. And we do have some good people in this city that are working on these things. But we need to continue, because it's 3 years. In a half a year, Black life expectancy dropped by 3 years because of one virus, because of COVID-19. And that is absolutely amazing. It's horrible. But it's amazing and it's horrible. So as you think about this and move through the medical system, be conscious, figure out ways to advocate better access, to advocate healthier neighborhoods and cleanup, to advocate for really investigating our medical system. I mean, one of, honestly, the easiest things is Medicare for all, but it doesn't begin or end there. There's so much that we have to do. So much we have to do, as with everything else. That is it for this week. Thanks for coming to Finding Warmth of Our Sun. My name is Matthew Brown, and I'm your host here at Masson 365. You can find us on YouTube, Apple Podcasts, Spotify, and Stitcher. Mask up, stay safe. We got that new nasty little variant here in Wisconsin that's going to become, widespread, potentially probably by early March, it looks like and sounds like from experts. Highly infectious. Keep your mask. I see some of you folks are traveling. Don't travel. Just don't do it. We want to talk about health, right? And we need to continue to expose and talk about the history of these things. Really for a real truth and reconciliation of our history. But anyways, thanks for coming and have yourself a good week. Thanks. Bye.
This is 365 Media.